Hello friends, I'm Dr. Schultz, and this week I have a letter from Chris F. from Oxnard, California, just north of the Los Angeles area. Dear Dr. Schultz, hello. My wife recently purchased your Incurables program, and she purchased it for me because I want to get out of dialysis, which is 3 times a week now. As you know, I'm limited to my fluid intake, especially fruit and vegetable juices, which increases potassium and phosphorus in the blood. And I'm sure you're aware of the complication like hives and cardiac arrest because I stopped urinating as well, so the fluid buildup is very uncomfortable. What is your, I guess it's opinion on this? Is there any way I could work around this program? Actually, I already wrote to you about this before we bought the program, but I didn't get an answer, so I decided to write you again, this time hoping to get an answer, and you bought the program. Well, let me comment on that right out the gate. That's a good sign. That's a good sign, Chris. It means that you asked me about it, you didn't get an answer, but you went ahead and bought the Incurables program anyway. Don't wait for me, brother. Move ahead on this. Move ahead on the program. So you want to know, can you do the Incurables program while you're on dialysis? What about the fruit juices? What about the vegetable juices? First of all, if you're on dialysis 3 times a week, do you know what the prognosis is for that? The prognosis is usually that you're going to be dead in 5 years. And how old are you? It doesn't say, but I get a feeling you're not that old. Okay, so it's not a good prognosis. You're going downhill, and with dialysis 3 times a week, you're going downhill fast. Okay, we got to turn this around. We got to reverse this, and that's what I did in my clinic. The last 10 years of my clinic, I worked almost entirely on people with degenerative disease, people that were dying, people that were on dialysis 3 times a week, 4 times a week. Okay, why is it in my clinic people had miracle healings and people got well? Because I turned up the intensity. I cranked up the volume. I tried to kill my patients with juices. I tried to drown them. I went to extreme measures. I found that the people that died in my clinic always died because they didn't do enough, never because they were doing too much. So I know you have some fear about the fruit and vegetable juices, and I know you can't drown yourself while you're on dialysis, and I know you're worried about the increases in potassium and phosphorus, but stop worrying, because the patients that died in my clinic, remember, died from not doing enough, not from doing too much. So don't worry about it. If you push too hard, your body will know it. You're not going to go into cardiac arrest. Get rid of that fear. And push. If you push too hard, you can back off a hair. My patients often ask me, how much do they take? And I would say, take so much that you vomit, and then back off just a little bit. Back off just a little bit. That's part of turning this intensity, turning the volume up all the way. My patients got well because they did too much. That's why they got well. Why did I have miracles in my clinic? That's why I turned up the intensity. So I love the fact that even though you didn't hear from me, you bought the Incurables program. Now it's time to start it. Use your good common sense, brother. Use your good common sense. You'll know when it's too much, but when in doubt, do a little bit more. When in doubt, push a little harder. I know that you can get your kidneys working again, you can clean those kidneys, you can stimulate those kidneys using the kidney detox program, which is all part of the Incurables program, doing all the programs, getting those fresh juices in. Look up, study all the juices out there that heal, rebuild, and flush the kidneys and the whole urinary tract. You can do it, brother. Your body's going to love you. You'll get off dialysis. You'll turn your life around, and you too can create your own healing miracle. Just stop doing what you do that made you sick in the first place, everything that made you sick, and start doing everything that's going to create powerful health and get your urinary tract back together. Focus on the good to eliminate the bad. Don't worry about the doctors. Don't think about potassium, phosphorus, complications.